Hi everyone, this lecture is about anticholinergic drugs. So these are also called as anti-muscarinic drugs or parasympatholytics. Before going to the drugs proper, we shall see some of the major muscarinic receptors, their location and their actions. So M1 receptors are mainly present in the autonomic ganglion where it causes depolarization, and gastric glands, it increases acid secretion, it increases intestinal secretion in enteric neurons, and in central nervous system it is associated with learning, memory and motor activity. M2 receptors are mainly present in heart where it decreases the rate of impulse generation in SA node, decreases conduction in AV node, decreases contractility in atrium, and it has very minimal action in ventricle because of very slight innervation, parasympathetic innervation, and it acts as an autoreceptor. It decreases acetylcholine release in cholinergic nerve endings. It causes tremor and analgesia in central nervous system and also cause smooth muscle contraction. So these are actions on M2 receptors. An M3 receptor is mainly present in visceral and bronchial smooth muscle where it causes contraction of the smooth muscle, and it causes constriction of pupil by contraction of sphincter pupillae muscle, and ciliary muscle contraction will be there where it causes accommodation of the eye. M3 receptor action on all the exocrine glands, it increases the secretion of all the glands, and vascular endothelium, these M3 receptors releases nitric oxide which causes vasodilatation. This is an overview of classification of anticholinergic drugs. So as I said, anticholinergic drugs are also called as muscarinic antagonists or atropinic drugs or parasympatholytics. So these are classified into natural alkaloids, semi-synthetic derivatives and synthetic compounds. Natural alkaloids, we have two compounds, atropine and hyoscine, otherwise called as scopolamine. And semi-synthetic derivatives, we have atropine methonitrate, homoatropine, hyoscine butyl bromide, ipratropium bromide, tiotropium bromide. Synthetic compounds, you have compounds which act as anti-secretory and antispasmodics. So among these you have quaternary compounds and tertiary amines. So quaternary compounds are propanthalin, oxyphenonium, clidinium, simitropium bromide, isopropamide, glycopyrrolate. And tertiary amines you have dicyclomine, valethamate and pyrazepine. Then you have MYDRIATIcs, which are cyclopentolate and tropicamide. Vesicoselective synthetic compounds, oxybutynin, flavoxetate, tolteridone, darifenazine and solifenazine. And anti-Parkinsonian drugs or central anticholinergics. So these are trihexyphenidyl, procyclidine, biperidone. So atropine is obtained from a plant called as ATROPA belladonna. So these are the berries of the plant and these are the flowers. And the Belladonna, the name implies beautiful lady. So in Victorian era, women used to use these drops, eye drops, which are prepared from Belladonna plants in order to dilate their pupil to make it more attractive and beautiful. So, and hence the name Atropa belladonna. This is Datura stramonium. So this plant contains atropine, scopolamine and many other antimuscarinic alkaloids. So let's see the actions of atropine on central nervous system. Here it depresses vestibular excitation, it blocks the cholinergic overactivity in basal ganglia. In high doses it causes cortical excitation, restlessness, disorientation, hallucinations and delirium, which is followed by respiratory depression and coma. So in low doses atropine cause excitation, whereas hyoscine cause depressant of the central nervous system. So what are the applications of actions of atropine in central nervous system. So hyoscine or scopolamine is mainly used in treatment of motion sickness because of its action on the vestibular system. Hence, since it depresses the vestibular excitation, it is used in the management of motion sickness, which causes dizziness, vomiting. So scopolamine patches are available, which is pasted behind the ear before the start of journey. This prevents motion sickness symptoms. And central anticholinergics, trihexyphenidyl, procyclidine and biperidone. So these drugs are used in the management of Parkinsonism. So because of its action on decreasing the cholinergic overactivity in basal ganglia. So in Parkinsonism, these drugs are used along with the levodopa, where it controls tremors more effectively. So as you all know, the three cardinal symptoms of Parkinsonism are tremors, rigidity and bradykinesia. And among these three symptoms, tremors are controlled effectively with central anticholinergics. And these drugs are drugs of choice in drug-induced Parkinsonism. So drugs like antipsychotics, they act as an antagonist on D2 receptors, which can produce drug-induced Parkinsonism as side effect. So in this condition, since levodopa cannot be used because all the dopamine receptors will be blocked by these antipsychotics, these central anticholinergics play a major role in the management of drug-induced Parkinsonism. An action of atropine on cardiovascular system, it causes tachycardia by blockade of M2 receptors in the SA node, and it also facilitates AV conduction. So because of these actions, atropine is used in sinus bradycardia and heart block. Actions of atropine on eye. So topical instillation of atropine causes mydriasis by relaxation of the sphincter pupillae muscle, and it causes abolition of light reflex and cycloplegia because it causes paralysis of the ciliary muscle, and it reduces lacrimal secretion by blocking the M3 receptors which are present in the lacrimal glands. So all these actions will cause photophobia and blurring of near vision. And the intraocular tension tends to rise in narrow angle glaucoma. So since atropine produces mydriasis, patients who have narrow angle glaucoma are prone to develop acute congestive glaucoma. So since atropine has very long lasting action, it is undesirable for refraction testing. So instead, atropine substitutes like cyclopentolate, tropicamide, these eye drops are used in refraction testing. Atropine is used in iritis, iridocyclitis, choroiditis, keratitis and corneal ulcer because it decreases the tone of the intraocular muscles, and also it is used alternatively with miotic in order to prevent adhesions in these inflammatory conditions. So home atropine eye drops, here the cycloplegia which is produced by these home atropine is unsatisfactory, whereas cyclopentolate produces good cycloplegic action, and hence it is used as an eye drop for refraction testing, especially in children where we need cycloplegia for proper refraction testing. It is also rapidly acting. And tropicamide, this is the drug which is mainly used in refraction testing in adults because it is very fast acting, and also it has very brief action. So because of this property, tropicamide is preferred drug in refraction testing in adults. Action of atropine on smooth muscles. All smooth muscles are relaxed because of blocking of M3 receptors. So especially it causes bronchodilation, where it reduces the airway resistance in asthma and COPD, and it causes urinary retention, so in prostatic hypertrophy. So this atropine is contraindicated in benign prostatic hypertrophy because it causes relaxation of the detrusor muscle and cause urinary retention. The drugs ipratropium bromide and tiotropium bromide. So these are atropine substitutes which are used as bronchodilator in bronchial asthma and COPD. So these drugs, they act selectively on bronchial muscle without altering the volume or consistency of respiratory secretion. So in contrast with atropine, so where atropine, it dries up the secretion, whereas these drugs ipratropium bromide and tiotropium bromide, it doesn't alter the volume or consistency of secretions, and it also does not depress the mucociliary clearance by the bronchial epithelium. So this is an advantage of these drugs, and it has gradual onset and very late peak of bronchodilator action. So this is more suitable for regular prophylactic use rather than the control of acute episode of bronchial asthma. So in those situations, beta-2 agonists are drug of choice. And it acts on the receptors which is located mainly in the large central airways, whereas your beta-2 adrenergic agonist, they act on smaller airways, whereas these anticholinergic drugs, they act on the receptors in the larger airways. So these drugs are more effective in COPD than in bronchial asthma, because in COPD the vehicle tone is more, and hence these drugs are more effective in COPD. So these are the drugs used in the management of asthma. So acetylcholine and adenosine causes bronchoconstriction. So hence we are using muscarinic antagonist to counteract the action of acetylcholine, and theophylline to counteract the action of adenosine. And beta-2 agonists are used because they increase the cyclic AMP concentration, thereby producing bronchodilation. And similarly, theophylline also, it inhibits the degradation of cyclic AMP and increasing the cyclic AMP concentration and causes bronchodilation. So these are the drugs used in asthma. Okay. Now we shall see some of the drugs which are used as antispasmodics. So dicyclomine, it causes smooth muscle relaxation in gastrointestinal tract, and hence it is used as an antispasmodic, especially in children. It also has antiemetic property, and so they are used in morning sickness and motion sickness, dysmenorrhea, and irritable bowel syndrome. Valethamate is an atropine substitute which is mainly used in dilatation of the cervix during labor when there is delay in the cervical dilatation. It is also used as visceral antispasmodic, especially in urinary, biliary, and intestinal colic. We have some atropine substitutes which are vesicoselective, so they selectively act on the urinary bladder. These drugs are oxybutynin, tolteridone, flavoxate, solifenacin, and dorifenacin. So these drugs are selective M3 antagonists. So they have anti-muscarinic, smooth muscle relaxant, and local anesthetic properties. So this relaxes the detrusor muscle, and hence these are used in detrusor instability, which causes urinary frequency and urge incontinence. So in conditions like post-prostatectomy vesicle spasm or neurogenic bladder, spina bifida, and nocturnal enuresis, there will be increased urinary frequency and urge incontinence. So in those conditions, these drugs will block the M3 receptors and causes relaxation of the detrusor muscle, and thereby reduce the symptoms of urinary frequency. These are some other atropine substitutes and their uses. Hyoscine butyl bromide is used for esophageal and gastrointestinal spastic conditions. Atropine methonitrate is used in abdominal colics and hyperacidity. Clydenium and isopropamide are used in nervous dyspepsia, gastritis, irritable bowel syndrome, colic, peptic ulcer, etc. And pipenzolate methyl bromide is used in infantile colics and abdominal cramps. Actions of atropine on glands. It decreases all the secretions. Sweat, salivary, tracheobronchial and lacrimal secretions are decreased because of M3 blockade. It reduces gastric secretion, especially pyrenzepine is a drug which acts as a selective M1 antagonist. It reduces gastric secretion in peptic ulcer. Propantholin and oxyphenonium are the drugs used in the management of peptic ulcer. And glycopyrrolate is exclusively used in pre-anesthetic medication and during anesthesia because it reduces the bronchial secretion which decreases irritation of the laryngeal muscle and prevents laryngeal spasm. Atropine increases the body temperature, especially in high doses, because of inhibition of sweating and also stimulation of temperature regulating center in hypothalamus. So because of these action, the body temperature is increased. So atropine fever is especially seen in high doses in children. Other uses of atropine are to antagonize the muscarinic effects of certain drugs and poisons. So atropine is the specific antidote for anticholinergics poisoning, organophosphorus poisoning. It is also used in the management of early mushroom poisoning, especially by inocybe species, where it produces muscarinic symptoms. It is used along with neostigmine to block the muscarinic actions of neostigmine. So, neostigmine is used in the management of myasthenia gravis, in decurarization, and in cobra bite. So, in these cases, we need only nicotinic actions. So, atropine is used to block the muscarinic unwanted side effects of neostigmine. Both atropine and hyoscine are absorbed from GIT and it penetrates cornea freely. 50% of atropine is metabolized in liver and the rest of it is excreted and changed in urine. Hyoscine is more completely metabolized than atropine and it also has better blood-brain barrier penetration. Atropine overdose can result in poisoning, Belladonna poisoning. So it can be due to accidental ingestion of the berries of Datura stramonium or ATROPA belladonna. So these are the symptoms of belladonna poisoning: dry, hard skin, dilated pupils, dilated blood vessels, which causes flushed face, delirium, dermatitis, dysphagia, diplopia, and delusions. Management of belladonna poisoning includes gastric lavage with tannic acid. The patient is kept in a quiet, dark room because the patient be having photophobia. And cold sponging or ice bags are applied to reduce the body temperature. Physostigmine is the anticholinergics of choice, which acts as an antidote for atropine poisoning because it counteracts both the central and peripheral actions of atropine. So it is used in the dose of 1 to 3 milligrams subcutaneous or IV. Apart from these specific measures, general measures like maintenance of blood volume, assisted respiration, and use of diazepam to control the convulsions are also used. There are two main conditions where atropine is contraindicated. So the first one is angle closure glaucoma. So in narrow iridial corneal angle, whenever there is narrow iridial corneal angle, use of atropine may precipitate acute congestive glaucoma and hence has to be avoided. And atropine is also avoided in elderly males with prostatic hypertrophy because urinary retention will occur. So since atropine delays gastric emptying, absorption of many drugs are slowed. And also, when atropine is used along with the drugs with additional anticholinergic property, additive antimuscarinic side effects will occur, and antacids interfere with absorption of anticholinergics. So these are some of the drug interactions of atropine. Thank you.